Hey, good morning, everybody. How y'all doing? I'm here once again to give you guys an update on how things are going with me. This is day number 6. I'm not going to make this too long. I'm going to make it very, very brief, very, very short. Um, so I'll let you guys know what I'm experiencing right now, which is, as you can see, I have not took off the strips yet. They inform you to not take them off. I know my doctor's office did. My doctor did. He said when I come back for the follow-up in a couple of weeks, he will assess it and take them off himself. So that's something I don't have to worry about. Now, regarding taking showers, which I have taken a shower, I took a shower 3 days post-op, 2 days, excuse me, post-op, and I didn't have any problems at all or whatnot. I know most of us, we're worried about infection, which is only right. Now, my voice this morning, my voice box has still been an issue. It's been one of the biggest issues or problems or hurdles getting over this operation. As you can hear, my voice is somewhat hoarse. It's not as strong as it usually is, and I have to watch my volume, so to speak, because my voice is very, very weak. My vocal cords are very weak right now at this particular moment. I spoke with someone recently, and they said it took their mother a whole month before her voice box, before her throat actually healed. She said it took them a month. I pray to God it doesn't take me a month. Um, Still having problems swallowing um, in the neck area, the throat area, excuse me. And if you can see, it's swollen all right here, and it's hard. It's very, very hard. It feels very kind of lumpy and very hard. You can, if you can see it. And the same goes for over here. It's very, very hard and it's swollen. It's very swollen and it's very, very hard. If I push it, it doesn't hurt or anything. But that is the effects from the incision that was made there and whatever they moved around in there. My vocal cords or Adam's apple, whatever they moved around. So I'm still dealing with that. Um, I've noticed the last couple of mornings I have been able to swallow, which is an improvement because it usually takes time for my body to warm up or whatever after I wake before I can actually really swallow. But the last couple of days I haven't had any problem swallowing. It just hurts like I don't know what trying to swallow. Excuse me, like just now. Um, and I have that issue, and I have another issue that's been rearing its ugly head in the last couple of days. I've been feeling pain in my spine, like in my spine, in my spine. I've been feeling pain. This one is between my shoulder blades. It feels like right between both of my shoulder blades on my spine is where I'm feeling a kind of a sharp pain. I can feel it here and there. Sometimes I can feel it more like, depending on how I move, I can really feel it. It's a kind of a sharp kind of a pain. It's not unbearable. It is bearable. It's not an unbearable kind of a pain, and it's not constant either. So that's something else that I've been dealing with as of late. Um, I've been sleeping better, thank God. At first, I was taking cat naps. I'll sleep for 5, 10 minutes, and then I'll be right back up again. But now I'm able to sleep for a good 2, 3 hours straight, or whatnot. I'm still not up to, you know, sleeping for a long term regarding hours after hours after hours. So that's been something. My chest, which was bothering me a couple of days ago, excuse me, I can still feel it here every once in a while, depending on how I breathe. Like I can feel it. It's not as severe as it was a couple of days ago. I can take deep breaths now without it actually hurting me too bad or too serious or whatever. So those are some of the things that I have been dealing with. I'm still taking my Cipro. I'm still taking my muscle relaxers. I'm still taking everything that they've instructed me to take, and I'm still going to do that. I've been trying to not use too much of the oxy because the oxy has really, um, it really helps. It does because this is a painful procedure. After the procedure, it is very, very painful, Like I said before, it's not as bad as when I had my labrum repaired. That hurt way more, in my opinion. But this also hurts too. I cannot take anything away from this at all regarding pain, because it is very very painful. So I take the oxy just because of the pain. But when I can stand it, I don't take the oxy. I leave it alone. But when I can feel it coming on, then I'll take the oxy or whatever it might be. I've been feeling pain here in my shoulder for some reason. I don't know what that is, because earlier I think I moved my neck and I weren't supposed to. Um, and I think that disrupts something or disturbs something. So I felt pain going down here from my neck, going down to my shoulder or whatever. It's not, I still haven't experienced any tingling or any numbness or anything. That part, which was a major, major issue for me at one point in time, I'm no longer, as of yet, experiencing those things in either arm. So that's been a blessing for me. Um, and that's about it. Um, is there anything that I'm missing? I may be missing out on something, a thing or two here or there, but that's pretty much the gist of it, pretty much. Um, I've been drinking plenty of water. You have to make sure you stay hydrated. Drink plenty of water. Um, I'm actually just making it back home because I was staying with my parents um, for the week. I stayed with them for a week because they have a nice recliner. I don't have a nice recliner. And I noticed the recliner works best for me because I can't sleep laying down. Now that I'm a bit stronger, I think that I can pull it off on my couch, or even in my bed. I think I'll just have to like kind of stack my pillows somehow and kind of be at an angle, because that works for me. Laying straight flat, it aggravates the neck. So I don't even try that or make an attempt to do that or whatnot. So that's the gist of it. If you guys have any questions, feel free to leave me a comment or whatever it may be. I thank you guys for your time. Have a good one. I'm gone. I'll be back with more tomorrow. Peace. Bye.